This video is not a training video. The simulations and video footage are for product information only. Formal training is required prior to FAST1 use. Remember the last time you were trying to save a patient and you could not get a vein? You are not alone. Vascular access in the field fails some 10 to 40% of the time. What about approaching a patient in full cardiac arrest and you just know her veins are going to be really difficult to get into? Studies show that the average time to get vascular access is 3 to 12 minutes. When seconds count, you don't want to waste them. The life of this patient is in your hands. Until now, if you ran into trouble trying to get an IV line in, you either kept trying, got your buddy to try, you went without a line, or maybe you just got some medications into the patient through an endotracheal tube. Imagine being able to achieve emergency vascular access reliably in 60 seconds, even under the most adverse conditions. Now you have the tool to achieve vascular access quickly and reliably every time. The FAST1 Adult Interosseous Infusion System was designed to save lives. The FAST1 achieves vascular access in the adult patient safely, effectively, and quickly. The FAST1 product line that includes the sterile disposable FAST1 system, the training system, and training supplies are produced at Ping Medical's manufacturing facility under a quality system that meets FDA and international medical device manufacturing standards. Each product is carefully assembled by skilled production technicians. The FAST1 was recognized for good design when it won the gold medal in medical device design excellence from Canon Communications. It allows vascular access quickly and easily, even in dark, awkward conditions. Finding the correct site is easy. You palpate the sternal notch and place a target patch. Getting it into the correct depth is completely automatic. You just have to place it perpendicular to the victim's skin and push it in until you feel the release of the handle.
The FAST1 is a very quick, reliable, and reproducible way of getting into the central circulation quickly. You do it through the marrow space, but we know from the good anatomy and physiologic studies that have been done before that by infusing into the sternal marrow space, we get medications into the central circulation very quickly.
We began using the FAST1 IO device approximately a year ago, and in that time we've had multiple uses of the device. We've infused 1,000 cc's of saline in roughly 5 or 6 minutes through the IO device. One particular patient we had was a patient that was severely burned over most of her body, including her torso, head, face, and arms. Due to the burns on her arms, she had no peripheral IV sites available to even attempt. Her neck was burned and we could not even attempt a jugular IV. So with even the relative contraindication of IO use on a burn site, with preparation of the burn site and prepping the skin to clean the skin, we had very fast access with our IO on this particular burn patient. She had a flat line or asystolic rhythm on her monitor, and because we were able to get the interosseous device placed rapidly, we infused large amounts of fluid and were able to get epinephrine and atropine medications into her system with the IO and convert her heart rhythm to a perfusing heartbeat with a sustainable blood pressure.
We've known from experience in pediatric patients for many years that the marrow space, the intraosseous space, is a means of getting medications into the central circulation quickly. But it's been difficult to translate that model into adult use because the landmarks are different, yellow marrow versus red marrow is different, and we haven't had a reliable way of getting into the marrow space quickly. The FAST1 has changed that. It's been shown in clinical trials to deliver medications into the central circulation very quickly, very effectively, get good physiologic effect, just as if we're infusing through a central line.
I'm Tom Stair from the Emergency Department of the Brigham and Women's Hospital in Boston, Massachusetts. I modified the technique of the FAST1 so it could be used in awake patients in the emergency department, simply by first anesthetizing from the skin down to the periosteum. Of course, before using it on them, I tried it on myself. The infusion rates were fine, there were no complications, it operated as advertised, and the patients liked it as well.
Ping Medical understands the importance of skills development and retention for all first responders and other emergency care professionals. That is why we have developed a fully integrated training system. The training system allows users to become fully trained in using the FAST1 in a 2 to 3 hour session, which emphasizes hands-on practice using a simulated procedure, as well as actual insertions into simulated bone. We ensure training is provided through our distributors using our training equipment and supplies. View our full-length training video. Visit our website for technique information and troubleshooting updates. Use the training CD for delivering the FAST1 training program.
I have used this product in training since February of 2001 when we started a process of training paramedics in our system. Maintaining skills after initial training is very easily accomplished with the training model. Many of the paramedics in our system have gone many months without using the device, and when they've had to use it, they've said that it was easy to use, the instructions are easy to follow, and the device is very simple and self-explanatory, and we think it's easy to retain those skills.
Our quality assurance program has revealed that this device can be placed in an average of 54 seconds. I really don't know how a department can handle the unexpected situations you come upon in a trauma call without this device to fall back on. Sincerely, Lanny Jones, Chief Flight Paramedic, EMS MedFlight 1, Richmond, Virginia. The FAST1 is available through our distributors. You may contact us at Ping Medical or visit our website for more information on the product and our distributors.